Hi, my name is Kasey Parker. I'm going to be doing my injection video for my subcutaneous injection and my intramuscular injection skill checkoffs. So I'm going to go ahead and get started. I'm going to start outside of my patient's room, and I'm going to be reviewing my patient's chart and the electrical health record. I'm going to be looking at her name, date of birth, and her allergies. So today I'm going to go see Miss Anna Pawlowski, and it looks like her date of birth is May 5th, 1957. And she's allergic to penicillin, and whenever she gets hives, whenever she comes in contact. So next I'm going to be looking at all of my patient's orders and verifying that I have those active orders for the 2 medications in the MAR that are ordered to be given today. And those 2 medications are the influenza vaccine and the B12 injection or cyanocobalamin. I'm going to look, and I do have active orders for both, and I'm going to verify to the MAR to make sure it's all correct. So it looks like I'm going to be giving the influenza vaccine intramuscularly, and I'm going to be giving 0.5 milliliters to Ms. Anna Pawlowski today at 1300, and that is dispensed as 0.5 milliliters, so no calculation is available or required. And then I'm also going to be giving the cyanocobalamin, the B12 subcutaneous injection. It's ordered that I give 500 micrograms today to Ms. Anna Pawlowski at 1300. And it's going to be through the subcutaneous injection route. And that is dispensed as 1 milligram per milliliter. So I do have to do a calculation to get my dosage for that. I can convert 1 milligram to 1,000 micrograms. So I do know that I need to give 0.5 milliliters to get the 500 micrograms of the B12. Okay. So I'm going to go ahead and check that. I'm going to do my first check. I'm going to gather my supplies here. I'm going to start and make sure that I have all of my supplies. I'm going to be using a 1 milliliter syringe with a 23 gauge needle, which is 1 inch long, to do my intramuscular injection, and that is going to be for my flu shot. I do have a multi-dose vial here, and I need to make sure that it's time dated, it's in date, and there are initials for whomever opened it. If I were to open it, I would do those things. And I want to check to make sure it is not expired, there's nothing floating in it. Okay. And I'm going to be checking that I have a syringe for my subcutaneous injection. That is going to be needing to be a 25 gauge needle, and it's going to be 5/8 of an inch long. And I do have that here. I'm going to check, make sure it's not soiled, it's not expired. I'm going to make sure all of my supplies are in good quality. And then I have my B12 injection here, my cyanocobalamin. It's also a multi-dose vial, so I have it being 500 micrograms. It's 1,000 micrograms per milliliter. It's got the time date and the initial of who opened it. And I can see that there's nothing floated in it. There's some particulates. Okay. I'm also going to need some alcohol prep pads, some gauze, and I'm going to have gloves that I do not have, but I'm going to verbalize that I'm using. And then I have labels to label my syringes after preparing the medication in the med room. And I have those labeled with my initials, the initials of the patient, Anna Pawlowski, her date of birth, today's date, the time, which is now 1300. I have the dose for each, the name of the drugs, and the volume. So for the flu vaccine, I have 0.5 milliliters. It's given today at 1300 to Anna Pawlowski, IM. And then I have my cyanocobalamin for Anna Pawlowski today at 1300, and I'm going to be giving 500 micrograms or 0.5 milliliters, and that is going to be subcutaneous injection. So that was my first check. I'm going to go ahead and pull up my drugs now. I'm going to do my hand hygiene here. I'm not required to put gloves on at this point. I'm just preparing my medications. Okay, so I'm going to start with the flu vaccine. I'm going to do the intramuscular vaccine. I'm going to be using the 1 milliliter syringe, and I have a 23 gauge needle. It's 1 inch long. I can use 21 through 23 gauge needles for this, and it needs to be 1 inch through 3 inches, depending on the size of the patient. I open these up here, and I need to make sure that the clean ends of the luer locks stay clean whenever I'm attaching them here. Okay. And I'm going to go ahead and label this with the flu vaccine so that when I draw it up, it'll be ready to go. And when I go to my patient's room, I can verify and know which one is which. So I'm going to go ahead and get my flu vaccine ready. I'm going to need to scrub the top of the vial 10 to 15 seconds and then let it air dry completely. Now I know I need to be giving the IM injection in one of 3 areas on the patient. I can use the deltoid muscle. So to find this, you find the bony aspect here. You want to go 1 to 2 to 3 finger widths down and create a triangle with your thumb. This is going to be your injection site here, and we're using Z-Track to give the injection. The second site is going to be your vastus lateralis, which is going to go from the top of your knee to the greater trochanter, from your superior midline to the lateral midline of your thigh, and this would be the injection site here. And the third would be your vastus gluteus. You're going to be going by putting the heel of your hand on the greater trochanter with your thumb pointing at the patient's groin, and you're going to create a V between your first and second finger here. In between the V is going to be your injection site, and you want to avoid all the nerves in all 3 of these places. And we're using Z-Track for all 3 of these injection sites. Okay, so I'm going to go ahead and draw up my medication now for the flu vaccine. Oh, this would need to be air dried, not. Okay, so I'm going to place the needle into the middle of my stopper. Oh, sorry. So I would first be drawing back the amount of air, which is equal to the amount of medication I need to be giving, which is 0.5 milliliters. So I'm going to pull it back to 0.5. And I'm going to need to inject that air to air in the middle of the stopper. And I'm going to invert my vial, and I'm going to pull up 0.5 milliliters of the flu vaccine, trying to avoid getting any bubbles. I know I need to tap my syringe to get all my little air bubbles out and to be able to give an accurate amount of medications. Okay, good here. I'm going to recap my needle safely. Okay. Next I have my subcutaneous injection, which is going to be the cyanocobalamin, which is going to be the B12. I'm going to be using my 1 ml syringe, and it's going to be a 25 gauge needle, and it's 5/8 inches long. We're going to clean the vial first. We're going to scrub the hub of that with alcohol. And we're going to have to let that air dry. Alright, same thing with this. We're going to make sure the ends of our lure locks stay completely clean. Okay, for this one I know I'm going to be giving Miss Anna Pawlowski 0.5 milliliters of the B12 injection, which equals to 500 micrograms. I'm going to be giving it today at 1300 in the subcutaneous injection route. Okay, that is my first check. I'm going to need to draw back 0.5 milliliters of air into my syringe first. And I also have a label already made up for this one. I have a label. I'm going to inject the air to air, and then I'm going to invert my vial and make sure to draw back without making any bubbles. I've got an air bubble, that's okay. Let me go back. Okay. There we go. Now I'm going to pull back so that I can get equivalent of 0.5 milliliters and inject that air at the top back up. There we go. Now that I have 0.5 with no air bubbles, I'm going to recap my needle. And I know that I'm going to be giving a subcutaneous injection either in the posterior aspect of the arm, of the upper arm, into the subcutaneous here, we're into the abdomen, anywhere below the costal margin to above the iliac crest, and you want to avoid the 2 inches to either side of the umbilicus. So anywhere in this plane is going to be your injection area. And the last one is going to be your anterior aspect of the thigh. You do have subcutaneous tissue here that we can use to do your sub-Q injection. So I'm going to label this one with Ms. Anna Pawlowski, my initials, date, and time. The route, I'm going to be giving the dose, which is 500 micrograms or 0.5 milliliters of B12 subcutaneous today, and it's ordered for right now for Anna Pawlowski. Okay, so now I'm going to be doing, okay, I did that check. So that was my second check, as I've done both of those. I did my first check, now I've done my second check. I'm going to go into my patient's room and I'll do my third check. Okay. Got all my supplies here. And I do have my medication card because I know I'm going to need to educate Mrs. Pawlowski on her medications today. Alrighty, so.
Hello.
Hello, my name is Kasey. I'll be your student nurse for today. I'm going to wash my hands.
Nice to meet you, Kasey.
Nice to meet you too. Miss Anna Pawlowski, may I please verify your name and your date of birth?
My name is Anna Pawlowski, born May 5th, 1957.
Alright, Mrs. Pawlowski, that all matches up. Can I see your armband? I need to verify that as well. Anna Pawlowski, May 5th, 1957. And it says that you have an allergy. Can you tell me what you're allergic to?
Penicillin.
Penicillin. What happens when you get penicillin?
I get hives.
You get hives? Okay. Gotcha. That all matches up on my record too. Oh, Miss Pawlowski. Alrighty. So today I'm here to give you a few injections.
Great.
Okay. I'm gonna be giving you first your yearly influenza vaccine, and we're gonna be giving it to you today in your muscle and your deltoid muscle. Okay.
Okay.
So I'm gonna tell you a little bit about it. Have you ever had a flu vaccine before, Miss Pawlowski?
Every year.
Every year? Good for you. Okay. Do you have any kind of sensitivity to eggs?
No.
No? Okay, good. Have you ever had a reaction to your flu vaccine before?
No.
No? Great. So I'm just going to tell you, after getting your vaccine, the most common side effects might be a little bit of a fever, a little headache, you might get general body aches, and you could have soreness in the injection site in your arm. So I'm going to be giving it to you in your arm. I'm trying to massage it. Are you right-handed or left-handed?
Right-handed.
Right-handed. So I'm going to go in your left arm so that you aren't overexerting it too much, okay?
Okay.
Do you have any questions about your flu vaccine?
I don't think so.
Okay, and your second vaccine, or your second medication today is going to be your subcutaneous B12 injection. You get this every month for your anemia, right?
Mm-hmm.
Okay, so I'm going to give you a little bit of information about that, adverse effects. So you're getting it today for your anemia. You have chronic anemia, and a few side effects from this may include some GI upset, some headache, and you might get some itching and swelling, okay? And you, again, might have some irritation at your injection site, okay?
Okay.
Do you have any questions?
I don't think so.
Okay, so I'm gonna go ahead and get started. Alrighty. So I'm gonna go ahead and make sure that I'm gonna pull my curtain, and we're gonna give ourselves some privacy, and I wanna make sure that there's nothing on the floor. I don't see any safety issues. I don't see anything cluttering the floor. I see you have your cowbell. Your bed is in a low position, and both of your side rails are up. Are you comfortable?
I am.
You're good. How's the temperature for you?
A little warm.
A little warm? There you go. We're gonna fix that right now, okay? Alright, so now that we've checked that, I've got my curtain closed, I'm gonna go ahead and check one more time that you are Miss Anna Pawlowski.
I am.
And I'm gonna be giving you first your flu shot. I'm gonna don my gloves after doing my hand hygiene. So Miss Anna, I'm gonna be giving you your flu vaccine. I'm gonna be giving it to you intramuscularly in your deltoid muscle. I'm gonna be giving it to you today at 1300, and it's ordered at 0.5 milliliters, okay?
Okay.
All right, so we're gonna go on your left side. All right, so I want you to try to relax your arm for me, okay? All right, let me get my swab here. So I'm gonna go ahead and clean the injection site. Like I said, I'm gonna find the bony prospect here and go down 2 finger widths and create a triangle, and that's gonna be my injection site. I'm gonna clean my injection site here. Alright, Mrs. Pawlowski, I want you to just keep your arm nice and relaxed, okay?
Okay.
Can you hold this for me on the bottom? Thank you. Alright, I'm gonna uncut my needle. I have my gloves on. Alright, Miss Anna. So I'm gonna go ahead and do my Z-track with my non-dominant hand. I'm gonna take this and I'm gonna move it over laterally about 1 to 2 inches, and I'm gonna go in like a dart at 90 degrees. Okay, and we're gonna go slowly inject. Okay, I'm gonna hold it for about 5 to 10 seconds to allow for the muscle to take all the medicine in. I'm gonna remove my needle at the same angle, and then I'm gonna let go of my Z-track, okay? I'm gonna need to cap my needle for safety here, and we're gonna dispose of that in our sharp area. And I would flap Mrs. Pawlowski's arm, not putting too much pressure or massaging. And if need be, I might put a Band-Aid on. Okay, Mrs. Pawlowski, how you doing?
Doing well.
Doing well, okay? All right, that's good. So now we're gonna be doing your second injection. It's
Okay.
gonna be your injection for your anemia. I'm gonna be giving you, Ms. Pawlowski, I'm gonna be giving you B12. I'm gonna be giving you 500 micrograms, which is a half of a milliliter, 0.5 milliliters today, subcutaneously, and I'm gonna be giving it to you, I'm gonna be giving you half of a milliliter. Okay, so where did they give this to you last month? Where do you normally receive this injection? Do you receive it in your abdomen?
On my
All right, that's what I have charted here.
Mm-hmm.
Which side did they do last month?
The right.
The right side, so you want it in the left side this month?
Yeah.
Yeah, okay. Okay, Miss Anna. So I'm gonna position your back in your bed a little bit just so that you can relax and not be sitting up. Your hamstrings, okay? So for this one, this is gonna be a subcutaneous injection.
Okay.
And I'm gonna start again by cleaning my injection site, starting in the middle and going outwards. So if his umbilicus is here, I'm gonna go at least 2 inches away. So I'll be going about right here. Starting in the middle and then moving out, away. And we're gonna let that dry. Alright, that's nice and dry. Okay, Miss Pawlowski. I'm gonna take it, I'm gonna pinch the subcutaneous fat up for about 1 inch. And I'm going to be darting it in at a 90-degree angle, just as before. Okay. We're going to slowly inject that one. Okay, and I can withdraw my needle at the same angle, and then I can release. And I'm going to do the same. I'm going to engage the safety for my needle, and this will go into the sharps biohazard. And the same thing, we're going to flatten this shouldn't be too much. Okay, Ms. Pawlowski, how you doing?
Doing well.
Doing well? All right, we're almost done now.
Didn't even hurt.
Didn't even hurt? That's great. Okay, Mrs. Pawlowski, I'm gonna go ahead and remove my gloves. I'm gonna wash my hands. Okay, Mrs. Pawlowski, so I'm gonna go ahead and clean up my area here. And I wanted to know, is there anything that I can do for you? Are you feeling comfortable?
I am. I could use another pillow.
Another pillow?
Yeah.
Okay. All right. I will make sure to go get you one. I'm going to step outside and document our injection that I gave you your medications, okay?
Thank you.
And then I'll find you that pillow.
Awesome.
Alrighty. So I'm going to go ahead and make sure that you have your call light and you have both of your side rails up. You're sitting comfortably in bed. Pillow. We are going to make sure that you have your possessions next to you, and I'm going to open up the call or the privacy curtain here. I'm gonna wash my hands again, and I'm gonna go get Mrs. Pawlowski her pillow. Thank you.